Good morning, everybody, and thank you for inviting me once again to these Marzieiev lectures. To me, this has become a very cherished appointment that I am very happy to keep year after year, although, of course, it is of a great sorrow to know that the current circumstances, the ongoing war, prevents us from meeting in person. Thank you once again for inviting me to be with you today, and I am very pleased and very happy to share with you updates about the work of the WHO in Ukraine and in Europe over the past several months that perhaps is going to be of relevance and support to the work that you all are doing in your country. Let me start with a very brief overview of how we are working with you, with our colleagues in the WHO country office, and with the partners in the UN family to take forward important aspects of the environment and health agenda. And I will start by demonstrating you this. This is the result of the work that we have done with you, with your community, and it is a checklist for strengthening water, sanitation and hygiene, emergency preparedness and response. We know that under emergencies, if there is one service that really matters, that is water and sanitation together with energy. These are the pillars of our capacity to respond effectively to emergencies, our capacity to prevent infectious diseases from occurring, and our capacity to maintain everybody dignified throughout as they live through emergencies. So I'm very proud of the work that our colleagues, in particular Oliver Schmoll and his team, have been able to do with you and our colleagues in the country over the last years. We have been working with you very much on the WASH agenda together with the UNICEF, but this has not been by all means the only area of work and collaboration with the Ukraine. Together with the colleagues working on chemical safety, we have been supporting and working with you, for example, towards the establishment of poison centers. And this is a very beautiful initiative whereby we are able to mobilize knowledge, support and experiences from other countries that are working through a very new partnership led by the United Kingdom to support the uptake of poison centers across Europe. And this is part of our agenda for the sound management of chemicals. And of course, we cannot conclude and we cannot think of working in countries without taking into account the work that we are doing together to prepare and to develop a sound risk assessment for climate change. What does it mean for the country? And here, once again, we have started working, mobilizing the support, the knowledge and the experiences of other countries that have gone through similar experiences and who can work together with Ukrainian experts and authorities to develop a very sound assessment of the climate-related health risks. Let me turn now for a second to the broader European agenda and what has kept us busy and what is of use to everybody in this community. As you know, we are part and parcel of the implementation of the Ministerial Declaration on Environment and Health that was signed in Budapest in 2023. As a part of that, we are helping member states to place new public health items on their agenda, for example, nature and health. And I know that we have experts from Ukraine who are, as I'm speaking, participating in a flagship online course to prepare the new leaders in the environment and health sector that will take forward the huge potential of nature and nature-based solution for health. At the same time, we have kept training and developing capacities to empower our leaders in environment and health ministries to withstand a much more complex and demanding agenda. This one requires new competencies, new capacities. It requires ministries of health to become more conversant with the topics that once upon a time would have been exclusive responsibility of ministries of environment and vice versa. So, for example, we need more climate change in the health agenda and we need more health on the climate change agenda. And for this, we need new capacities. This also means that we need to prepare our workforce not only to work across sectoral boundaries, but also to become prepared to judge, assess, and implement new technologies. There is a huge promise coming from digitalization and artificial intelligence, but we also need to understand the dangers and how we can use these new potential technologies to the very best to improve our health and our environment. I wish to highlight and to close this meeting, this intervention, pointing towards next week when in Copenhagen 53 member states of the European region will gather once again under the Regional Committee for Europe gathering of Ministries of Health. They will be there to adopt the new program of work for the European region, United for Europe and United Health for Europe. And through this work plan, we will see a much stronger attention placed to prevent and to keep us secure. So health security will be at the forefront, together with attention to climate change and better health systems. I hope that this will be a moment for multilateralism to prevail, for broad consensus to be gathered, and for us to be able to look more confidently into the future together. Thanks once again for your attention, and I wish you a great conference.